So what could put your health and your wallet at risk? Well, find out in just 60 seconds. But first, let's go to our New York newsroom where Marianne Rafferty is standing by with the other headlines. Marianne.
Hi, Greta. Investors are reacting positively to steps being taken to address Europe's debt crisis and also an unexpected drop in unemployment claims. The Dow rose 113 points, NASDAQ was up 3.5 points, and the S&P added close to 11 points. But the gains weren't enough to erase yesterday's nearly 400-point drop. Traders have been worried that debt troubles in Italy and Greece could spread to the U.S. And Alaskan authorities assessing the damage left behind by a massive storm that slammed the state's western coast this week. Hurricane-strength winds and sea surges flooded the shoreline, torn rooftops and knocked out power in at least 37 communities. So far, at least one man has been reported missing. Forecasters warn another storm is on the way, but it's expected to be much weaker. I'm Marianne Rafferty. Now back to On the Record.
Your health care and your money, could they both be at risk? Senators Tom Coburn and John Barrasso say if you are on Medicare, or your parents, or even your grandparents are, better watch out. President Obama's national health care law, according to these men, could pose a big danger. Now, the senators are also both doctors, and they have written their own version of the Medicare handbook. We spoke with them earlier tonight. Senators, and I should say doctors, nice to see both of you.
Thanks for having us.
Well, I see the government has the Medicare and You 2012 book out, and you guys have a competing Medicare and You 2012. This is your book. Is this a parody?
Well, you might consider it. It's actually much more truthful than the other one.
In what way?
In terms of describing what the Obamacare legislation has done to Medicare patients.
How they took $500 billion away from our seniors on Medicare, not to save and strengthen Medicare, but to start a whole new government program for other people. How they're going to have unelected bureaucrats making decisions about who gets what care and how much the government pays for it. I mean, you go item by item of why Medicare is a lot more at risk now in terms of even going bankrupt than it was before Obamacare passed.
Okay, so if I'm clear, that we were on an unsustainable path before President Obama's national health care. Then he shepherded through the national health care, and we're still on the unsustainable path. But I'm curious, you say $530 billion was taken out of Medicare. What was it taken from, and where to go?
Well, it's going to go for a Innovation Council, $10 billion. It's going to go to subsidize the state exchanges, the mandated care that all of us will have to buy if we can't demonstrate that we have it. So there's a subsidy there. So we're taking money that people have paid into Medicare, taking it out of Medicare and subsidizing the care for other people who've not paid into Medicare.
And it's going to come out of home health care, hospice care, hospital care, doctor care, physical therapy care, care for our seniors, care that they need. So it's ultimately going to be denying care and refusing care.
Is it fair to say that, in your opinion, it's coming out of services and going more into sort of administration or bureaucracy? Is that a fair description?
Well, that's part of it, but that's not the vast majority. The vast majority of it's going into other programs for other people for health care that Medicare dollars weren't paid for to begin with. And remember, Greta, we have a problem. The hospital trust fund, by the most rosy scenario, will be, if you assume we're going to grow at 4.5%, everything that you would not assume will be bankrupt in 2026. The conservative scenario of that by Medicare trustees is 2016. If you look at it, that's been declining every year. It'll be 2014 by 2013. So the trust fund that actually pays for your hospitalization will be bankrupt in less than 4 years. That money came out of that trust fund to go for these other programs. So what are we going to do? We're going to go to the markets now with all the international financial problems that we're having, and we're going to borrow money to pay for hospitalizations for our seniors? No, we're not. But we created all these new wasteful programs and other programs in the health care that will take that money that should have been there and put it somewhere else.
It seems to me that's a problem we're going to feel in the near future, according to what I say, but not quite as near as the problem is going to hit in January. A lot of doctors are going to lose a lot of the reimbursement under Medicare, which I assume is going to discourage a doctor from wanting to care for people. It's going to be harder to find a doctor, or am I wrong on that?
I think you're absolutely right. It's going to be harder for someone on Medicare to find a doctor to take care of them, especially if they move to a new community or if their doctor retires. It's going to be much more challenging. So those are the
And
real...
I actually don't blame the doctors. I mean, frankly, I know you guys are both doctors, but it takes an awful lot to get to become a doctor, and to be sort of, submerged in all this paperwork and also get your fees reduced. It makes it hard to run an office.
Well, it does two things. One is, if you really practice medicine the way we're trained, there's no way you can pay your nurses and your overhead on Medicare reimbursement if you practice the way. But they don't anymore, because Medicare has such low reimbursement. They end up seeing way too many patients every day to be able to afford to see those patients and keep their office open. And what we're going to see that going on down. So the real question for Medicare is, you've got a Medicare plan, but if you can't get a doctor, do you have health care? And that's what's happening all across this country. The people that are turning 65 this year and becoming Medicare eligible, half of them are having trouble finding a physician.
But even under the cut, if you do find a doctor under Medicare, in light of the economic pressure that we're putting on the doctors have got to push you through quickly so you don't get your questions answered that you might have. And so I'm not sure the level of care, because people, especially as you get older and have health problems, you want questions answered. The quality is going to go down.
And one of the things that, as a consequence of that, when a doctor doesn't spend the appropriate amount of time with you because they can't afford to, what do? They order a whole bunch more tests to cover what they didn't get to ask you about, so that they make sure they're not missing anything. So we increase all this testing that is really unnecessary, because we won't reimburse and recognize the value of a physician relating to a patient and paying them for the time that they'll spend with that patient.
And the president uses the word coverage and care interchangeably, but they're very different. I mean, there may be a time coming very shortly where someone with a Medicare card can't get care.
What would the president say if he were standing here and he were listening to the two of you talk? I assume he'd say you guys are dead wrong.
He'd disagree. He'd disagree. He'd say, we have such a big problem in healthcare, we had to do something.
We have a problem. We all agree on that.
Everybody admits that. $1 out of $3 that we spend in healthcare doesn't help anybody get well, doesn't prevent them from getting sick. That's a problem. Why is it there? The reason it's there is because the government controls 65% of it and has mandated down price control, where you've disrupted the market. I use an example all the time. I cared for about 300 Amish families. None of them had health insurance. They were the best purchasers in the world of health insurance, because they wanted to know what something cost. They wanted to know why you were doing the test. They wanted you to explain what the risks of the test were. They wanted to know where they could buy it cheaper. In other words, they reconnected the purchase of health care with the payment. And so therefore they got great value. And I gave them great value because I was happy to get paid and not have to go through an insurance company or through Medicare and have to file all the paperwork and everything else. So what we've done is we have two different philosophies. One is the government's smart enough to run health care. We've proven that that isn't right. And that Obamacare's expansion will destroy health care in this country. And I'm not sure that's not what they intended, so we can run it all. Number two, what we know is the quality of care is going to decline in the future unless we really put patients and physicians back together making those decisions.
We're talking about patient-centered care. That's what we want. Care that's best for our patients, so that patients get the care they need from the doctor that they want at a price they can afford. But this health care law, it's bad for patients, it's bad for providers, the nurses and the doctors who take care of them, and it's going to be terrible and continue to be terrible for taxpayers.
Senators, thank you both.
You're welcome.
Thanks
Good to be
Greta.
with you.